The top stories on Sky World News. The World Health Organization is predicting that up to 4 million people could be infected with the Zika virus this year. The virus, spread by mosquitoes, has been linked to brain defects in babies. The Italian Coast Guard has released dramatic pictures of the rescue of a family who were on a sinking boat near the Greek island of Samos. At least 25 other migrants have drowned in the same area. Republican presidential frontrunner Donald Trump has held his own rally as the rest of the candidates battled it out in their final TV debate in Iowa. More now on our top story, the outbreak of the Zika virus in South America. The World Health Organization is warning that it could spread globally and explosively. So just how serious is the risk for the rest of the world? Sky's Ian Woods has more at the news screen.
Well, the virus was first detected in Uganda in 1947, but no regular outbreaks were reported until 2013. This pandemic started in Brazil in May of last year. In just 8 months, it has infected an estimated 1.5 million people in Brazil. And this week came confirmation that it has spread to 22 countries across South and Central America. That's twice as many as a week ago, and it now includes Barbados and Mexico. Even though Zika is usually mild, the evidence linking it to brain-damaged babies means that the governments of Jamaica, Colombia and El Salvador have gone as far as advising women to consider delaying their pregnancies for a year or two. And the World Health Organization says the outbreak will spread across the whole of the Americas, potentially creating 3 to 4 million cases over the next year.
The explosive spread of Zika virus to new geographical areas with little population immunity is another cause for concern, especially given the possible link between infection during pregnancy and babies born with small heads.
Up to now, it's thought it was only transmitted by bites from the Aedes group of mosquitoes that can only survive in tropical or subtropical regions like these. But it's now thought it could also be transmitted by the much more common Culex mosquito. There are 20 times more of them around the world, taking not just in the Americas, but also parts of Africa and Asia. The World Health Organization is holding an emergency meeting on Monday to decide if the Zika virus outbreak should be declared an international health emergency.
Well, we're joined now by Professor Peter Hotez, Dean for the National School of Tropical Medicine at Baylor College of Medicine in Houston, Texas. If I can start off by asking you, Professor, just how easily could the Zika virus spread from South America to the rest of the world?
Well, thanks for having me on. So we're seeing an incredibly rapid spread. This was introduced into Brazil a year ago. There's more than 1 million people infected. There's 700,000 in Colombia, and you can just watch the virus move up to the tropical regions of South America, then into Central America, now into the Caribbean. So I believe that by the end of February, the entire Caribbean will be affected. So this is a fast-moving virus, something very impressive. What's so scary, of course, is the link to birth defects. So we're seeing large numbers of babies being born with this horrific congenital birth defect known as microcephaly. And so we've got to take some very dramatic measures to stop this virus.
But the WHO is not definitely linking this microcephaly to the virus yet. I mean, if it isn't the virus, then what could be causing these birth defects?
Well, it's looking pretty clear-cut. So what we're seeing is that you can isolate the virus from the babies that have microcephaly, not all of them, but in many of them. You can find it in the amniotic fluid of mothers with this and the placentas. So we don't have all our I's dotted and T's crossed. But how else do you explain this 20-fold increase, the presence of the virus, and temporally coincides when the virus got introduced in the Americas? So the point is, I don't think we can wait for the final I to be dotted and the T to be crossed. We have to implement public health measures right now.
And is there something of the, I know this is very different from Ebola, but the fact that we're hearing language like explosive from the WHO, are they trying to get ahead of this because they were obviously criticised for their response to Ebola earlier on in the outbreak?
Yeah, it's easy to criticize them and say this is an overreaction from their previous underreaction, but I don't think this is the case. I think they're being measured, and I think they're absolutely right. I think there's a good chance now this is going to go into the Gulf Coast of the United States. Remember, we have no window period to be wrong. Many of these cases are asymptomatic, so unless we intervene right now, if we wait for 9 months for babies to be born from microcephaly, then it's going to be too late. We can't make the same error that happened in Brazil happen in the rest of the Americas. So we have to intervene right now.
And in terms of the search for a vaccine, this is a standing start, isn't it? Whereas with Ebola, there was a bit of run-up time, if you will.
Yeah, I mean, we're at least 2 years away from a vaccine. We make, here in Texas Children's Hospital, we're in Sabin Vaccine Institute, we're making vaccines in the nonprofit sector. We make the vaccines that the drug companies won't make. It's at least 2 years away, maybe 3 years. So we have to go back to old-fashioned public health control measures. The good news is that they work. So we know, for instance, that when South America was faced with a terrible epidemic of dengue and yellow fever in the 50s and 60s, they went on a military-style campaign to eradicate the Aedes aegypti mosquito, and it worked. They eliminated the mosquito in 18 countries and stopped dengue fever and yellow fever for a period of time. We could do that again and delay things long enough till we get a vaccine, but it's going to require very aggressive measures. We're going to need a great leader, a field marshal that's going to want to lead these efforts. So it's not going to be easy. It's going to be tough love, but I think it has to be done.
Professor Peter J. Hotez, thank you very much indeed for your insight.